Good morning, good morning. I'm Dr. Dangleben on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel. This is your topic of the day. I want to talk a little bit about sarcoidosis, which is also considered an autoimmune disease. It's a systematic inflammatory disease, right? So systemic inflammatory, right? So the entire system. And what it does, it forms this globules of immune cells called granulomas that are active. It's most common in the lungs and the lymphatic system that drains the lymph, which is part of the immune system, over your body, but it can affect any organ system, your skin, your eyes, your heart, your liver, etc. Like I stated, the cause is really unknown, but it has an exaggerated immune response. The immune system is responding to an unidentified antigen. An antigen is something that comes into the body that the body is supposed to, attack, but it's not fully understood. They think that there is some environmental, component, maybe some even infectious components, such as, mycobacteria, the same class that would form TB, right? And also the genetic predisposition, coming back to that HLA type genetics that I had talked about prior, making us black people a little more susceptible. Okay, is there some sort of error in the coding, let's just put it that way, in the immunologic process that's causing this, right? And these granulomas that I talk about, they just continue, right? And then they can get fibrotic, causing a lot more problems in the chronic stages. What are some of the signs and symptoms? A lot of times early on it can be asymptomatic, right? General symptoms are really like, the general stuff. You really can't pinpoint it. The fatigue, the fever, the weight loss, the night sweats, which can go along with any type of autoimmune problems initially, right? 90% of the cases will have some lung involvement. So you'll have a persistent dry cough. You can start developing shortness of breath. You could have chest tightness, discomfort, or pain, right? And if you have skin involvement, you can have tender red nodes, right? They call them nodules on the shin, right, and certain other parts. And that's important. That's called erythema nodosum. You can have inflammation of the conjunctiva, right? Conjunctivitis. Your vision starts getting blurry, and you can progress to heart problems. Cardiomyopathy, which is a stress on the muscle of the heart. You could start developing some funky rhythms, right? And there's a lot more to it. Your spleen can get large, your liver can get large. So, again, it affects a lot of things. There's a staging system. We're not going to get deep into it, but it's based on X-ray, right? It's classically staged by a chest X-ray, all right? If you have sarcoid and you have a normal chest, you're at stage 0. And as you go from there, you're going to have, some enlarged lymph nodes around the central part, stage 1, stage 2, stage 4, etc. So again, just, basic stuff. To get more information, I would recommend a CAT scan to look at the extent of these granulomas and how involved, they are, and whether or not there's any fibrosis involved, right? And the diagnosis is really radiographic, right? You get the images. You look for the non-caseating granulomas. You can do some blood tests, right? But very non-specific, but can support your diagnosis, like an elevated serum ACE level, angiotensin converting enzyme, which actually comes from the lungs. All right. What else? You could have hypocalcemia, right, which is due to an increased vitamin D activation by the immune cells. All right. And there's a lot that you can do. And ultimately, you can do a biopsy, right, showing these granulomas, making a definite diagnosis. Management, many cases resolve spontaneously, which is good, especially in asymptomatic stage 1. Okay, and that's what we hope for. But the first line therapy is corticosteroids, prednisone, right? And again, I know a lot of folks wants to shy away from these things, but you don't want this to progress to stage 3 and stage 4. All right, you can move on to the harder hitting agents, the methotrexate, azathioprine, which is really very immunosuppressant, suppresses your immune system, right? And don't forget the supportive care. Oxygen therapy is important, right? Now you have these oxygen concentrators that you can have at your bedside. There's a lot of things that you can do at home, right? See a doctor, have a regular cardiac monitoring, get your annual eye exam, right? This is important for sarcoid. The impact on us, it's more common in black people, period. All right, particularly black women, rates of up to 3 to 4 times higher than in the white population, right? That's what Bernie Mac died from, Reggie White, a football player, right? So it's out there, all right? So again, just be cognizant of what's going on with you and your health, right? We know about the health disparities. There's delayed diagnosis and treatment. And when that sets us back, we end up in stage 2, 3, and before we know it, we're in stage 4, which is the fibrotic stage and complications. So sarcoid is a multi-system disease. The cause is really unknown. There's speculation about the causes, right? The classic finding on X-ray is the fullness in the central part with large lymph nodes, all right? And we blacks are more affected more and have more severe disease, all right? The first line treatment is corticosteroids. Prognosis varies. Many resolve spontaneously. That is the lining, right? So again, chronic disease can cause irreversible organ damage. We don't want to get to this point. All right? So if you're having shortness of breath, if you're having a cough, have it worked up. Don't have it dismissed for years on end to the point where you get to fibrosis and severe non-caseating granulomas from sarcoidosis. All right? Let's continue to educate each other. I'm Dr. Dangleben. Have a great day. Peace.